Good evening and thanks for joining us. We have been warned there is no quick or easy way out of this pandemic. That reality is hitting hard in Quebec tonight, where millions of people are back under tighter restrictions. Starting today and for at least 27 more days, a partial lockdown is in effect in 3 virus hotspots: Montreal, Quebec City, and the Beauce region. That means bars and restaurants are closed except for takeout, as are theaters, casinos, and museums. No park gatherings or visits to other people's homes are allowed. To help bars and restaurants get through the next month, the government is offering to cover 80% of their fixed expenses.
I know we've made some tough decisions in recent days, but there are lives in danger, and fighting the virus must remain our top priority.
Here's what's worrying. Quebec is reporting nearly 1,000 new cases today. Over the past 7 days, it's recorded an average of 793 cases per day. Here's the rest of the country. It's important to point out the Atlantic bubble is working. Just 1 new case is being reported in that region today, and some restrictions are now being eased in PEI and Nova Scotia. Alberta has 173 new cases today. BC has 82. Ontario has 538 new infections reported today. That's down from over 600 yesterday. But there is a problem. With more and more people in Ontario getting tested, the province's testing backlog is getting worse. Today, there were more than 82,000 tests waiting to be processed at labs. And now there's more confusion over who should be getting tested in Ontario. For weeks now, people were told everyone who wants a test can get a test, and kids who had even one minor symptom like a runny nose or sore throat often needed a COVID-19 test before they could go back to daycare or to school. Now, Ontario Public Health says that's not necessary.
We are changing the policy or clarifying that schools and daycare should not be requiring a negative COVID test. In fact, they shouldn't even require a doctor's note.
Now, rapid tests could, in theory, reduce the backlog and take some of the pressure off labs in this country. Health Canada has approved a handful of rapid tests, and the federal government has committed to buying millions of one kind of rapid tests made by Abbott Industries in the U.S. But Ontario's premier said today he doesn't want to rely on them. And as Abigail Bimman discovered, it's going to be quite some time before millions of these rapid tests are actually delivered.
In an interview with Global News, Health Canada's chief medical advisor says while the government bought up to 7.9 million newly approved rapid tests, we're not getting them all at once, and we're not getting 8 million anytime soon.
Hundreds of thousands of tests fairly shortly within this first few months, and then moving into, I think the total is close to 2.5 million tests. That'll take us into the early part of 2021.
Dr. Supriya Sharma says the tests will be doled out based on several factors: per capita case numbers, epidemiology of outbreaks, and the rural-urban split.
The provinces and territories are in the process of looking at what their needs are and submitting those to Health Canada. We haven't received those yet.
The Abbott ID Now is a PCR test. It works by detecting the virus's DNA. Back in the spring, the U.S. Food and Drug Administration flagged concerns about its high false negatives, and a New York University study found that a different rapid test, the Cepheid, performed better. The Trump administration is now deploying a different test from Abbott, the Binax Now antigen test, which is based on proteins.
What America has seen with Abbott and some of the other rapid tests in terms of high false negative rates is not acceptable. So as a result, United States policy has shifted.
The other announcement that the Prime Minister made about the Abbott testing, that's going to help. Don't get me wrong, but it's not the rapid test. I have confidence that they're going to get this out, and I really look forward to it because it's a game changer.
Health Canada says it can't comment on the American concerns and data from the spring.
The version of the test that we did see was supported with evidence to show that it was picking up cases, with the nasal swabs at a rate of at least 93%.
This test is not something that basically they've thrown at us and said, please here, take it, without any additional testing. They have provided all of the additional clarification after exposing some of those potential weaknesses.
And that other test the New York University study found performed better, Cepheid, well, that's one of the few approved for use here too, and it's already in use, including in northern Manitoba. Canada has purchased about 1 million of those tests. Global News asked why not more compared to the 8 million Abbott tests. Dr. Sharma said it had to do with supply capacity, what the company was able to provide in the short term. Abigail Bimman, Global News, Ottawa.